A very good afternoon to everyone. Welcome to today's session on pre-pregnancy counseling and care by Apollo Fertility. To speak on the topic, we would like to welcome Dr. Garima Sharma, our in-house consultant, obstetrics and gynecology. She has done her MBBS, MS obstetrics and gynecology, DNB in OBGY. She is also a gold medalist in reproductive medicine. We welcome you, doctor. You can now take over the session.
Thank you, Chatura, for that kind introduction and welcome back. It's always a lovely time to connect with you all, and I hope that it was a great Diwali for everyone. Now, getting back on to our work. So, today the topic for discussion is going to be about preconception counseling and care. Now, just to give you a brief insight into what I'm going to talk about, we have all been talking about infertility and its treatment. We have been talking about pregnancy journey in its 9 months. But what we forget is, what do we really need to know before we plan for a pregnancy? Is it really worth talking about your health? Is it really worth planning your pregnancy? And therefore, I have come with this topic of preconceptional counseling and care. Today, I'm going to discuss this topic in a format which I have never done earlier. So, it's going to be a simple PowerPoint presentation. The idea is not to get you bored with any kind of a literature, but just, to set the flow of event, it makes things little simplified. Give me a minute and I will be just sharing my screen for the same. So, as I was discussing with you all, now often we forget. So, our emphasis is that yes, now I'm pregnant, what is coming next door? But if you ask me, the objectives today start from right the time when that seed comes in your mind that tomorrow I am going to plan my pregnancy. So, a pre pregnancy optimization of your health, then the good 9 months care of your entire pregnancy. And equally important is your postpartum period, where we often forget to talk about the importance of breastfeeding. However, breastfeeding and the antenatal care is not my topic for today. What I will be centering on is what is preconceptional care. The preconceptional care is basically evaluating the overall health of the couple, the would be father and the would be mother, in terms of knowing what is the nutritional status of that lady who's going to get pregnant, what is the fertility score of that couple who is looking out for now planning a pregnancy. And the whole aim is that you want to have a very smooth journey from a preconception to conception to delivery and the post delivery of the child. The whole idea of obstetrics or the pregnancy planning is to have a healthy mother and a healthy baby. And that is why today we are talking on this preconceptional care. I'm often asked this question nowadays that, doctor, what is the right time to initiate this preconceptional care? And if you ask me, I think any visit to a consultant who deals with the fertility or with pregnancy, that visit can be optimized to discuss about your concerns and also get yourself evaluated. If you look at this, you see would be surprised that since 1950s across the globe, there has been an emphasis on preconceptional care and counseling, which has not been the concept in India. And what do you really do? The first, this is a pyramid, okay? You first look at the risk. Risk for what? Risk for any medical disorder, risk for any other issues that could be complicated during your pregnancy. The second part of the whole care is the health promotion. That is through your lifestyle modification, through a good diet, good exercise, and stress management. Optimize your pre pregnancy period so as to have a smooth pregnancy time. And the last of all, if there is any risk or you encounter any problem, be it related to fertility or be it related to any other medical disorder, where we doctors intervene and get the things sorted before you plan a pregnancy. So nowadays, because especially in the metropolitans, this is what people come to me, that they would want to plan a pregnancy but not immediately, and they're not so sure that what is the time till which they can delay a pregnancy. Now, in the Indian pretext, what I always tell a couple that if you wish to kind of plan delay your pregnancy planning, it is very important for us to know that where do you stand today from the fertility perspective. And this can be easily evaluated through these three, four things that I have shown you here. First is a female age. In my last talks, also, I have been giving a lot of importance on the impact of age on the egg forming capacity for a female. And as we now know very clearly that post 35, we see a decline in the egg forming capacity in terms of count, in terms of the quality of the egg, and therefore the resultant sequelae that there could be fertility issues or higher risk of genetic issue to the child or even miscarriages. The second factor that is important to be tested is that tomorrow, when you are pregnant, the uterus or the womb, which is going to carry your child for good 9 months, how healthy it is. The third thing is the fallopian tubes, that is the part or the place where a sperm and an egg are going to fuse together to form a child. And most important, another component is the male factor. That is, through a basic semen analysis, you look out for a count, you look out for a motility and the shape of the sperms. Now, in case all these factors are, any one of these factors, let's say, is abnormal and which might impact our fertility if we plan to delay the pregnancy, then it is high time that you kind of plan your pregnancy through the options that I'm going to discuss a little later. Now, for any couple who, despite having these tests done and showing some kind of an issue, still does not want to plan a pregnancy immediately, the couple should be thinking about an egg freezing and an embryo freezing. And I have an entire talk, especially on egg freezing, which I have done a couple of weeks earlier. Now, coming on to the next part. Now, this couple who's come to me is now ready for a pregnancy, and now they want to know, doctor, what we should be taking into consideration before we plan for a pregnancy. And the first thing that I emphasize on is a nutrition. And I am a very staunch believer that the Indian thali, which has a sabzi, a roti, a dal, a salad, is an integral thali which gives you the right proportion of carbohydrate, fat, vitamins, micronutrients, and the proteins that you need. In nutrition, we also give a lot of importance to folic acid that I have been emphasizing to all my couples. Now, folic acid is a part of a vitamin B family, which plays a very important role from the child is, you can see a positive pregnancy to the point the child is delivered. And an Indian diet, no matter whatever you do, Indian diet is deficient in this folic acid. So a folic acid supplementation should always be started 1 or 2 months before you plan for a pregnancy. And this, being a part of a vitamin B family, will never have any kind of an untoward side effect on your body. Also, when you are looking for an evaluation, it is also important that you look out for basic things like your calcium levels, your hemoglobin, your important vitamins like vitamin D, vitamin B12 before you really head towards a pregnancy. So this is what I was talking about, that the folic acid plays an important role in preventing something called as a neural tube defect. Now, this is a genetic defect in the spine or the neural development of a child. And since 1950s, even the World Health Organization has emphasized on fortification of food with folic acid, and also why do you need the folic acid before you plan a pregnancy. So, if you're planning a pregnancy, a good zero point 0.4 to zero point 0.5 milligram of daily tablet of a folic acid, which can be started 1 to 2 months prior to your planning, should be good. But in case you have some risk factor, for example, you or someone in your family has a history of genetic issues, or there has been a recurrent miscarriage, then it is a time that you meet your gynecologist, because the dosage and the duration of this supplement might be little longer and more for you. Anemia, another very untouched and a very ignored corner of the Indian population. A simple hemoglobin test gives you a clue as to where do you really stand. Remember, whenever you are pregnant, because of the natural pregnancy changes, your hemoglobin is automatically going to drop down during the second trimester and the third trimester. And if you have an unhealthy start, imagine what is coming in your way. There could be need of injectable iron, there could be need of blood transfusion, because we never had a healthy start. So for me, A month or 2 months prior to planning the pregnancy, get your hemoglobin tested. If this shows a deficiency, meet your doctor and start on basic supplements with iron and certain food which are rich in iron. Also, it is a very good idea to consider deworming with a single dose of albendazole tablet a month prior to planning a pregnancy. Again, something where the whole world is showing a hue and cry about this optimal body weight management. Now, if you ask me, doctor, I am 60 kgs, what do you think? Where do I stand? It means nothing to me. A 60 kg for a 5 feet female and a 60 kgs for a 5 feet 11 inches female is almost completely different. So you always have to analyze what is your body weight in comparison to your height, and this is given by a marker called as BMI. And if you look at my this chart, to begin with, what we say normal is something called as an 18 to 22.9 kg per meter square of BMI. That's considered normal before you plan a pregnancy. In my further slides, I'm going to show what is the impact of obesity as well as being lean on your pregnancy. So, our first is overweight and obesity, and there is no shortage of the problems that it comes with. If you talk about issues, developmental issues to the child, yes. If you talk about chance of a preterm labor, yes. If you talk about mother complications, with mother being at high risk of diabetes or blood pressure or blood coagulating issues, yes. Overweight and obesity comes with this big package of complications to mother as well as to the child. And if you tell me that someone knocks down my door and tells me, doctor, I am wishing to lose my weight, and I tell that lady, okay, fine, let's meet after 6 months, you go and reduce your weight, it will never be done. Management is always a collaboration between the person who's taking that journey, me, or a fertility specialist or a gynecologist, an endocrinologist who would try to understand whether your metabolism is slow, a dietitian or a nutritionist who would take care of the right proportion of the diet, and a physical trainer. So it will always be a collaborative approach which will give us the results. And what do you look at? You would just wish to reduce about 5 to 10% of the weight that you are today in a span of 6 months. And believe me, it's quite a doable thing if you go in the right direction. Yes, I understand India as the Western population also is heading towards a sect of population which has a very high BMI, where we call it as a morbidly obese kind of a population. In these given situations, sometimes a bariatric surgery might also be required. Exercise and physical activity, all my talks you must have seen and heard is, and always gives emphasis on diet and exercise. And I always give you that simple mantra of 30 to 40 minutes of some workout 5 days a week would be giving you a fantastic result. And if you ask me what workouts, I always say bring in change. So if we are doing a workout for 5 days, I look at giving 2 days of a cardio workout, which could be your brisk walking, jogging, dancing, aerobics, anything. 2 days of your strength and conditioning workouts, and a day for your yoga stretches or your basic flexibility stretches that you can do. By bringing in a change to your exercise format, you tend to break your calories even further. Now, we have seen what obesity does, but some people also have that concept of size zero, thanks to our Bollywood society that came out with that size zero component. But now we know that underweight, that's being BMI less than 18 kgs, also comes with its own set of problems. Automatically, your baby is going to be underweight. There is also going to be a possibility of preterm birth. So, as is overweight being is considered dangerous for pregnancy, so is being underweight. A big no to anything which is called as smoking, addictions, alcohol. And trust me, there is nothing called as this type or this level of alcohol which is safe in pregnancy. This is something important where I thought that there are certain communities in India where the marriages happen in their own religion, or where the pregnancy nowadays, we see this is a common situation, pregnancies are happening beyond 38 years, or there has been a history where previously a child has been affected with some genetic issue, or there have been recurrent pregnancy losses. Before you plan the next pregnancy, it is a time to meet a genetic counselor as well as a fertility expert to discuss the various possibilities and rule out any kind of a genetic abnormality to your child. Also, it is a good idea to get your overall health checkup because you don't want to come across these problems. That's your thyroid, your blood pressure, sugars, heart issues, or epilepsy during pregnancy. Vaccination is something which is quite untouched, and when I talk to people, they will always tell me, doctor, ye to kabhi kisi ne bataya hi nahi. And this is what something marked in yellow, rubella vaccine. I have been behind people for this. Now rubella is a type of a virus, and majority of us have been exposed as a common flu. अभी कभी कोल्ड होता है या फीवर होता है तो हम जाकर तो नहीं देखते हैं कि कौन सा वायरस आ गया, until and unless it came as a COVID situation. बट रुबेला की प्रॉब्लम ये है दैट इफ यू हैव नॉट बीन एक्सपोज्ड, अगर आपकी इम्यूनिटी नहीं है एंड टुमारो यू आर प्रेग्नेंट, then rubella impacts the child development first trimester to second to the third trimester, as low as impacting the mental ability of the child, impacting the vision, impacting the hearing, and also certain in times it also impacts the heart development of the child. So it is always good idea to understand whether you have an immunity to rubella. If yes, good. If no, then please consider a vaccination. Avoid pregnancy for a month, and then you can kickstart your pregnancy efforts. The other vaccines which people ask me, like flu shot or hepatitis B or the tetanus vaccinations, these can be safely given during pregnancy, but definitely under the supervision of your obstetrician. It is always a good idea that as a couple you get yourself screened for diseases like HIV, hepatitis B, and hepatitis C. And if you are on any current medications, please review and discuss it with your doctor whether it is safe to continue during pregnancy. If not, then consider a dose change or a medication change before you look out for a pregnancy. So, having scrolled through all these slides, you must have now understood that there are so many things that you need to discuss before you plan a pregnancy so that you can have a comfortable journey in those 9 months. But my important question is that, when I talk about this particular thing, people take it that it is only for female. And that's why I came across this slide that do you really think that preconceptional care is important for men? As I always say, it is a couple who's involved in this 9 months of journey and not the female alone. And this gives an opportunity for a man also to get himself evaluated for any kind of a health risk and be a part of this journey in helping the female accept and get adapt to this beautiful phase. So, to conclude, I would say that preconceptional care and counseling is a part of a preventive medicine. That is, before you come across a situation where you come across a complication, you kind of diagnose it before and take the necessary actions. It ensures that a woman enters her pregnancy in a good mental and physical health status. And it also includes looking out for risk, assessing that risk, and educating people about the need of a pre pregnancy care. And I really hope that it becomes a routine part of our practice in India too. To end my talk, I would like to say a positive mind, positive vibes is equivalent to positive pregnancy. And with this, I can see my chat box full of questions. So, someone has asked me, Doctor, should we adapt to any lifestyle changes before planning our pregnancy? Yes, that's what we have always been emphasizing on. Now, when we talk about the lifestyle change, our idea is that you adopt to a lifestyle which you can sustain even in pregnancy and post pregnancy. So, a good nutritional care with a balanced diet and an active life, which I talked about, giving yourself at least basic 30 minutes of some kind of a workout, should be good. Stress is something which we need to accept that it is not going out of our lives. But how do we really manage it? How do we take that 15-20 minutes from our day to day life, which kind of gives us that relief or where we can stay away from the stress? These are few lifestyle changes that I always tell my people who visit me before they plan for a pregnancy. Also, because of the kind of professional lives that we are into, eating late, resorting to a lot of outside food, the junks, a lot of caffeinated beverages and aerated beverages, and also a lot of alcohol and smoking use. They're all deleterious to not only our health but also to the again the sperm quality. So all these should be taken into account before you plan your pregnancy. Doctor, so someone has asked, does weight gain before you get pregnant affect pregnancy? So as I had emphasized that there is a particular range. So we look out for a good 18.5, or say I would say 19 to 23.5 BMI as a good start for a pregnancy. Now the weight gain would has to be considered whether you have gained the weight over and above the normal, or you were on a leaner side and now you have gained the weight to come to the right kind of a BMI. So both obesity and being underweight are a big no before you plan a pregnancy. And if this is a situation, be in touch with some doctor or some endocrinologist who can help you out sort out the issues. What tests are mandatory before planning my pregnancy? A very practical question. So I would divide these tests into two parts. The first is your overall health status, that tomorrow, if you are pregnant, then there should not be any nutritional deficiency to your child. If I talk about these tests, then I look forward to basic a hemoglobin, a sugar, a thyroid, vitamin levels, checking for immunity for rubella, and sometimes looking out for a thalassemia screening is something a basic minimum that I ask for. The second aspect is that if you are heading towards your 30, then it is also good time to look out for the fertility test, that is what is the egg forming capacity through a blood test and sonography, what is the status of your uterus, and what is the sperm quality through a semen analysis. So generally overall pre-pregnancy health tests and a fertility test is what we recommend. When should we stop using birth control? Now, whenever you are ready for planning a pregnancy, it is a good idea to stop birth control pills at least 6 to 8 weeks before you plan. And in this gap of 6 to 8 weeks, always use a barrier or a condom as a protection. How will my other health conditions change during pregnancy? Now, pregnancy in itself is a stage where your immunity is already low. Your body's requirements are high because you are already dealing with one more life in you. The nutritional requirements are more because your child is also deriving the nutrition. So, if you are having any pre existing health condition which has not been taken care of or has not been controlled before you have become pregnant, then there are chances of worsening of that health condition. Therefore, it is always important to get a routine health checkup. If there is any possible risk factor of, or there is any obvious health condition, get it controlled and then go on the maintenance level under supervision when you are pregnant. Will my medications affect my fertility? Depends. That's why I said whatever medications you are on, it is always good to check with your doctor whether these medications would interfere with your pregnancy planning or fertility, and then take a call. Will age affect my chance of getting pregnant? So I had the last talk was on an advancing age, and to give you just a brief about it, yes, age is one factor which in the entire fertility journey we cannot control. As in how a female age advances, the egg reserve does decline both in egg forming capacity, quantity, and quality, and therefore there could be a little lesser fertility potential compared to when you were at 30. Also, as in how you progress your age, you enter into your 38 or 40, there is a very high incidence even of miscarriage and genetic issues. And also, as you age, certain other medical conditions like hypertension, diabetes, which are age related diseases, they might also set in if you have a family history. So, a right age to begin your pregnancy is what I always advocate. So
Thank you,
I
Doctor.
think we
Yeah.
are done with, yeah. So I think we are done with these questions. So by now you must have all understood what is the importance of a preconceptional care, and there is no harm consulting a doctor. There are different portals nowadays available, be it the teleconsultations, be it the physical consultations. But a timely opinion, a timely help saves us from multiple problems.
Thanks a lot, doctor. That was such an informative session on pre-pregnancy planning and care. We look forward to having you on more such sessions, doctor. Thanks a lot.
Thank you,
Thank
Jay.
you all for watching our page today and on the topic. I hope you have all your doubts clarified by doctor. Please keep watching our page for more such informative sessions. Thanks a lot. Thanks a lot, doctor.
Thank you.